We are keeping an eye on your health this afternoon. Back with us is KDKA Health correspondent and Pittsburgh Post-Gazette writer Abby Mackey. And today we are talking about some concerning news when it comes to the COVID-19 vaccine, specifically for kids. So tell us what's going on and who this is impacting.
Yeah, so earlier this month, both the FDA and the pharmaceutical company Moderna issued public letters after learning that the vials of Moderna's COVID-19 vaccine for kids may have been overfilled. Now, the real issue with that is that in the vast majority of cases, healthcare providers are used to emptying vials of single-dose vial vaccines. So if they did that in this case and they were overfilled, they would have inadvertently given these kids too much of the COVID-19 vaccine.
So how much more? Like, was it a lot more? Do we know?
So unfortunately, we don't know. I personally corresponded with the FDA and Moderna for this story, and they certainly answered some of my questions, but they didn't answer that one directly. They also didn't answer why they were overfilled. So as of right now, we don't know if this issue affects all vials of the COVID-19 vaccine for kids or maybe just particular lots.
Wow. Okay, so what does this mean for kids, and what about parents? What should we do?
Yeah, so for right now, parents, if they have any questions, of course, check in with your pediatrician. And then also, it's turned into an educational issue for healthcare professionals, because the issue here is not quality, it's quantity, right? So there's just too much in the vials. So initiated by the FDA and Moderna, hospital systems are now just trying to re-educate their healthcare professionals to make sure they're giving the proper amount to kids.
Okay, so now with this vaccine as a whole, how many people are getting it, and especially kids?
Yeah, so just before this Moderna issue came out, it just so happens that the CDC updated the public on how many Americans are getting the vaccine this season. And so that's also interesting because there is a 2023-2024 version of the COVID-19 vaccine, much like a flu shot, right? So it's oriented toward the strains of the virus that are supposed to be prevalent in the community right now. But when it comes to the pediatric population in the United States, only 2.1% of our kids have gotten this vaccine this season.
Very, very small. Okay, so what are hospitals and doctors doing about this issue?
Yeah, so I checked in with Allegheny Health Network. They're of course aware of the issue, but it actually doesn't affect them. They were only using the Pfizer version of the vaccine anyway. So far as UPMC is concerned, they are using the Moderna COVID-19 vaccine for kids, but they're aware of this issue. They're following the lead of Moderna and the FDA and educating their healthcare professionals to keep kids safe. But this is also an educational opportunity for parents, I think. Just a reminder to stay engaged with the healthcare process. And for parents who have questions, just to remember that you're well within your right to ask the questions that you have, ask about which version of the vaccine your kids are getting, and that having that peace of mind, of course, is the most important part.
Well, and it's also relatively new for us, so it's a great time, like you said, a lot to learn and good to ask questions. Thank you, Abby. And Abby's articles on the Pittsburgh Post-Gazette website right now if you'd like to check it out. And then this Sunday, Abby will have another story in her series on blue zones discussing the secrets to living a longer and healthier life. That'll be in the health and wellness section, sponsored by UPMC in this Sunday's Pittsburgh Post-Gazette.